Hey guys, welcome to the Nurse Educator channel. Thank you guys for supporting this channel. Thank you so much for liking, subscribing to my video. I truly appreciate it. Okay, so today I want to talk to you guys about the difference between an LPN and an RN. As a nurse educator, I get this question quite a lot because people don't really know that, LPNs are still being used by a lot of facilities. So they're always wondering, what's the difference between an RN and an LPN? So with an LPN, they are still considered a nurse, right? So they still take an NCLEX. It's called PN NCLEX. So they're still taking their NCLEX just like an RN takes. The only difference is they are limited when it comes to certain things. So an LPN, and depending on the state, right? So I'm speaking from the state of Illinois and several other states. They are limited. They cannot do IV push. So LPNs cannot do IV push medication. Even if they get IV certified, they still cannot do IV push. So IV push medication or pain medicine or any medication that needs to be pushed through a syringe, right, directly into an IV. An LPN cannot do that. Another thing that an LPN is limited to is administering blood. Depending on the facility, sometimes they'll have an LPN and an RN. An RN has to start the blood, but the LPN can verify. There's some places that they don't even use LPNs at all to verify the blood administration. It's usually two RNs, but the LPN can monitor the patient if that's their patient, right? So those are the two main things between both. So depending on if the LPN has an IV certification, they can start IVs, right? So LPNs cannot take care of midlines, right? Not midlines, sorry, I apologize for that. So LPNs cannot take care of central lines. They can't even start one, like they can't get PIC certified or anything like that. But RNs, of course, we already know they can, right? So with LPNs, they can only do peripheral lines if they are IV certified. IV certification, it's usually a short course. Sometimes it's a couple weeks long. It can be included in your LPN program or separate. You would just have to look for a program that offers the IV certification. Okay. Trying to think if there's anything else. Those are really the main things, because I do get a lot of students, they're not sure if they should just go for the RN or start out with LPN. It depends on your life, right? Some people have kids, they have a lot going on, and they can't commit to the long term commitment or the many years or 2 years for the associate program for an RN or the 3 or 4 years for the bachelor's of an RN, but they're able to commit for to a couple months of the LPN program. Sometimes there's programs that are just a year. We have some intense programs that are just 8 months or 8 months full time as an LPN, as a practical nurse program. So you have to find what works for you. Okay. If you are someone that is thinking about becoming an LPN, you're not sure if you should just go straight to your RN. Just think about your ultimate goal. What I always tell students is, why are you becoming a nurse? Right? Do you want to work in the OR? Then okay, I can't work in the operating room as an LPN. So I might as well just go for my RN, right? Do you want to work in the ICU? Okay, I have to have my RN. So it just depends on your specialty. So if your specialty requires RN, for me personally, my advice would be just go straight for your RN, right? Maybe just take your time, do a part-time program if you have a lot going on with your life. If you don't, just go for it and take your RN. Because the problem is, a lot of times when LPNs, if that's you and you start off as an LPN, life happens, right? And you might just lose track of what you ultimately wanted to do. Okay, guys. And then if you are someone who maybe you're okay with just working the nursing home or clinic, and you don't really want to specialize or go further into nursing, then I would just say just get your LPN. Get your LPN, but just be mindful, as an LPN, you probably will not make the same as an RN, right? Usually the difference can be all the way up to $10 difference, depending on the location. It can be up to 20 or 30. It can be even as little as like $5 difference. So do your research, find out what works best for you, and then just make the move. Okay. I hope this video was helpful for you, especially for those who are not nurses and still trying to decide if I want to be an LPN or an RN. Okay. Feel free to like this video, subscribe to this channel. If you have any other questions for me, if there's a video that you need me to talk deep about nursing, any specialty you want to know more about, any burning questions about, what was it like to be a nurse for 11 years and just all the various specialties that I've done. If you're not familiar, I have done cath lab, step down, clinic. I've worked as a nurse educator. I've worked as a vascular access nurse. I've done travel nursing. I've done strike nursing. I've done per diem nursing. You name it, I've gotten exposed to it. So if you have any questions, feel free to let me know, guys. Thank you so much. Bye, guys. Have a good one. Bye.